Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today, November 3rd, 2025. This video is on a Lancet article published on October 28, 2025, titled Peripartum Cardiomyopathy. It's a seminar. What is peripartum cardiomyopathy? Peripartum cardiomyopathy is heart failure with reduced left ventricular ejection fraction, less than 45%, occurring towards the end of pregnancy or within months after delivery. How common is it? Incidence varies globally from 1 in 1,000 in the US to as high as 1 in 102 in Nigeria. Who is at higher risk? Risk is higher among women of African ancestry, older maternal age, multiparity, preeclampsia, and those in low resource settings. What symptoms suggest peripartum cardiomyopathy? Fatigue, shortness of breath, ankle swelling, and orthopnea appearing late in pregnancy or postpartum should raise suspicion. How is it diagnosed? Diagnosis is clinical plus echo confirmation of reduced left ventricular ejection fraction less than 45% and exclusion of other causes. Why is early diagnosis important? Delayed diagnosis leads to worse outcomes. Early therapy improves recovery. How is it treated during pregnancy? Treatment includes beta blockers, diuretics, hydralazines, nitrates. Avoid ACE inhibitors and ARNI until postpartum period. What is the role of bromocriptine? Bromocriptine blocks prolactin cleavage and improves recovery in some patients. It's recommended in the European Society of Cardiology guidelines. Can women with postpartum cardiomyopathy breastfeed? Breastfeeding may be avoided in severe heart failure to allow medications. Cautious approach for mild cases. Why is anticoagulation considered? High risk of LV thrombus and embolic events around diagnosis warrants prophylactic anticoagulation. What is the expected recovery rate? Approximately half recover fully by 6 months. Recovery can continue beyond a year. What predicts poor recovery? A left ventricular ejection fraction less than 35%, LV dilatation, long symptom duration, wide QRS width, low human development index setting predicts worse outcomes. What is the peripartum recovery score? A validated model using left ventricular ejection fraction, LV size, QRS width, symptoms duration, the human development index, and preeclampsia predicts 6 months recovery. What complications can occur? Heart failure, arrhythmias, thromboembolism, and sudden death are major risks. When to consider ICDs? ICD implantation is deferred at 6 to 12 months. Unless persistent left ventricular ejection fraction less than 35%, a wearable defibrillator can be used. Is subsequent pregnancy safe? Pregnancy risk persists. Relapse of around 25% if the left ventricular ejection fraction is below 55% before pregnancy. Multidisciplinary care is essential. How long to continue GDMT? Continue to around 6 to 12 months after full recovery. Taper cautiously with monitoring. Are genetic factors involved? Up to 15% harbor cardiomyopathy-related mutations. Example, TTN truncations. Can postpartum cardiomyopathy occur after miscarriage? Yes, it can follow pregnancies ending in loss or preterm birth. Does mental health matter? High rates of depression and PTSD, that is post-traumatic psychiatric disorder, stress disorder, warrant screening and support. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.